Alright, so we're going to go over how to test cervical flexion active range of motion using a goniometer. The testing position, as you see here, a chair with a back support, and for stabilization we have a gait belt here to essentially prevent his thoracic spine from bending forward, but we'll also let the patient know to avoid that. The patient can have their hands on the knees, and basically we'll instruct the patient to bring their chin to their chest and to avoid any lateral flexion or rotation, so purely bending forward of the head. The infield for flexion is going to be firm due to posterior ligaments of the neck, tension in the muscles, and joint capsules of the vertebrae. Our normal AAOS range for cervical flexion is 45. And then I'll show the anatomical landmarks and alignment for goniometer for the initial position. Actually, use a smaller one. So the fulcrum should be at the external auditory meatus, and then the stationary arm will be vertical, and the moving arm will be at the base of the nares. So can I have you sit in a neutral position? Thanks. So that is the initial, and we have him at 90. And then can I have you bring your chin to your chest as far as you can, and then of course stop if you're in pain. And once you come to that end range, just hold it there and try not to bend your thorax or your shoulders forward. And then we'll take the second measurement, keeping this vertical and the moving arm going to the base of the nair, and we'll read that off at about 43. You can go back to normal, and the only thing to make sure is that they don't bend forward here at the shoulders, and that's how you do cervical flexion. Alright, real quick, same deal with the inclinometer. You don't want the patient to move their shoulders forward, so it's the same exact testing position. And ideally you have two of these. One will go at the top of the head and one will go on T1, so you can take the difference to subtract any type of thoracic movement out. But since we only have one, I'll put my finger here and make sure he doesn't bend forward too much. So can you go to neutral? Right. And then making sure he doesn't bend forward at his shoulders, bring your chin to your chest as far as you can, please. And we'll read that measurement at about 45.